And what I'll say is, I think for all of us here, we definitely are what I will call change makers. And so we're passionate about asking people to do something different or change a behavior in order to have a very specific outcome. And if you're here and you're part of a VDC team or a technology team, or you're working on the technology side, there is a burden of proof on you to ensure that what you're promising or what you're asking has the outcome it delivers. This session was a deep dive into how to understand your audience in order to ensure that you can deliver on those metrics, define them first, and then deliver. So one of the biggest, I'll just give you kind of like the three biggest takeaways. The first was, when you are thinking about working with a community or asking someone to change a behavior or implementing technology, know your audience. Take the additional time up front to really understand who your audience is, understand and articulate the barriers in front of them, and also be able to understand what matters to them and how they want to be communicated. I think many times we just think if it's logical, it'll be adopted. Well, we as humans are highly illogical, shocker. And honestly, having somebody who understands the psychology behind change is critically important. So know your audience. Make sure that the messaging is correct for different audiences. So Jackson was very amazing in this, and he shared around sharing financials with his organization when it's 10 people versus 70 people. Very different. You can share the same information, but tweak slightly differently so that each can get the takeaways that they need. That's intentional. That has to be built into how you're communicating to your organization. And then the third and final piece really is around the messaging matters, and the metrics that you're measuring this messaging against matters. How are you leveraging the technology that you're deploying to actually capture some of that metrics for you? But it can't just be the technology usage. It also has to be surveys. So have at least 3 points of understanding, either interviews, surveys, the data within the technology, and your own metrics that you've set for success, whether that's usage or whatever. Have at least 3 metrics in place to be able to cross-reference and really get a good idea if success has been achieved. I am incredibly honored and excited to host this roundtable discussion, which I will start off by saying this is a case study. We're literally going to walk through something that I think many of us who have been change makers within construction, whether on the technology side or the process side or the people side, I think this is something each of us are secretly fascinated by, which is the connection between psychology and transformation. Typically, we're talking about this through changing behaviors and adopting technology. But today, we're going to really speak to the art of change and hopefully walk through a case study of how do we balance the 2 parts of this, the change management piece, which is how we get people to change their behavior and adopt new behaviors. And the second piece is, what is the creative aspect of this, which is more art than science, and where does that art and science come together? So I'm very, very excited to lead this session today. Nathaan Demers is, Nathaan, hold me accountable. Okay, good. Is our guest today, and who is the creative genius, and I don't use those words lightly, behind Man Therapy, which we're going to kind of walk through today as a case study in really looking at that relationship between technology, art, and science of how we influence individuals and change behaviors. So today we really want to walk through, and this is a framework I think you're used to if you're attending the Construction Progress Coalition events. But the questions we're going to be asking is, how might we really unpack how creative messaging creates this thought provocation or actions to very specific targeted groups. And I think if you've done any technology implementations, you know who that group is, essentially the end user or your target audience. And how do we do that in ways that the power for good to break down stigmas really creates that place of what we call psychological safety. But the outcome of that is to drive awareness and really generate action, get people to take action, so that change initiators, individuals, and if you're tuning in, you're most likely a change initiator, can really build consensus with opposing groups prior to the transformation campaign. And so those are the questions that we're asking ourselves here. Honestly, nothing easy to unpack here. But we have an expert who is going to be joining us and kind of talking through how he's done this. So before I introduce Nathaan to you, I do want to first give kudos to Cal Byers, who is our consummate connector in industry, especially around the topic of mental health awareness, and was supposed to join us today, but is in such demand. He was actually double booked at this time. And he's in another webinar actually helping healthcare providers think about the connection between pain, opioids, and addiction. So we thought, yes.
I think he's on a beach somewhere, but
the excuse was phenomenal. Let's just say that. But we really want to start to get into digesting the mechanics of this transformation. But first, thanks to Cal for introducing us to Nathaan. So when we think about what the mechanics of transformation are, when I first had the opportunity to meet Nathaan and learn more about his work and man therapy, he introduced us to this next slide, which I wanted to put up. It's a readiness model. And if any of you are involved at all in change management, whether it's implementing technology or addressing topics like mental health, some of this may be very familiar and intuitive to you. But I wanted to kind of lay this groundwork at the front end, because as Nathaan starts talking through the case study of man therapy and how he combined art and science together to create a really impactful movement, these steps 1 through 9 are invariably the pieces that you as that change agent need to be keenly aware of. So going from no awareness to getting awareness, but then denial and resistance, to vague awareness, to pre-planning, looking at how we go from pre-planning into really preparing and having preparation be the primary focus, to that activation point, or that when the nuclear kind of fusion happens and we create initiation. And then from there to what does it look like to create that stabilization of post-fusion stage? And then really expansion / confirmation. So looking at how are we taking the movement and the motion that's happened and really starting to build that into sustainable growth. Then finally onto how do we make this a piece of ownership that the community itself has ownership of? And I think for those of you who are joining us from the technology side, you're going to say, I'm used to working in stage 1 and then being asked by my bosses to produce stage 7, 8, and 9 without thought of 2 through 6 through that. And so I feel like having an understanding of this model is really important as Nathaan starts to talk through to his work. So with no further ado, please let me introduce you all to the VP of Clinical Programs and Strategic Partnerships at Grit Digital Health. Nathaan is going to walk us through a case study essentially of a program that he was part creator of. His background, he is passionate about people. I don't think you could get into this line of work without being passionate about people, but his training is a clinical psychologist. So I guarantee many of you have thought we really need a psychologist in the role prior to implementation. If that's been your thought, well, this is your chance to really hear what it looks like to have a creative psychologist at the helm.
Well, thank you so much for having me. Really excited to be here. And just a little bit more of my background. So I am a clinical psychologist and I practiced for a number of years. And then I actually joined the nonprofit world implementing large-scale systemic behavioral health interventions in the Western 15 states and American territories in the Pacific. And that was my first foray into, rather than one person being my client, all of a sudden Alaska was my client, or American Samoa. And I just realized how passionate I was about working at that higher strategic level. And I quickly learned that there aren't a lot of clinicians working at that higher level of care. And I feel very strongly that if we don't have clinicians shaping those systems, they're probably not going to work best for our consumers or our care providers. And then I was lucky enough 6 years ago to join a team at a startup called Grit Digital Health that our mission was largely the same thing, but doing so through a technology lens. And this case study is actually our first tool that gave rise to the business, quite frankly. Well, thank you so much for having me. Really excited to be here, and just a little bit more of my background. So I am a clinical psychologist and I practiced for a number of years. And then I actually joined the nonprofit world implementing large-scale systemic behavioral health interventions in the Western 15 states and American territories in the Pacific. And that was my first foray into, rather than one person being my client, all of a sudden Alaska was my client, or American Samoa. And I just realized how passionate I was about working at that higher strategic level. And I quickly learned that there aren't a lot of clinicians working at that higher level of care. And I feel very strongly that if we don't have clinicians shaping those systems, they're probably not going to work best for our consumers or our care providers. And then I was lucky enough 6 years ago to join a team at a startup called Grit Digital Health that our mission was largely the same thing, but doing so through a technology lens. And this case study is actually our first tool that gave rise to the business, quite frankly. So zooming back out and speaking change management, what we were really tasked with was examining and trying to change the culture around mental health, specifically in working aged men, or the lack thereof the conversations of mental health with working aged men. So as I'm sure many of you know, there's a lot of paradoxes that lead men to being pretty averse to the conversation of mental health. For example, perceptions of weakness. When we look at a lot of historical campaigns around mental health, they are somewhat kind of soft. They don't speak to men. And I know I'm being stereotypical, but head in hands, cloud, doom and gloom, like those aren't things that people want to go towards. With men, there's often a culture of suppression. I'm going to figure it out myself, and I'm going to pull myself up by my bootstraps. And Sasha, ready for the next? So with that, unfortunately, a lot of those themes give rise to a lot of really atrocious health outcomes, quite frankly. So we know that depression is the leading cause of disability in the US. It's estimated about $210 billion is lost in annual GDP. And getting into suicide rates, we know there's about 40,000 completed suicides every year in the United States alone. That's the equivalent of about a 737 crashing every day with no survivors, to put that in context. And 7 out of 10 of those tend to be white men. So we knew that this is a really big challenge that we needed to address. The third point, men are much more likely to die by suicide than women. We can do a whole webinar on why that is. And then also active duty and veterans account for a large percentage of that suicide rate. So all things that we really wanted to tackle. And back in 2012, the Office of Suicide Prevention in Colorado came to us. Colorado, that's where we're located, unfortunately tends to be in the top 5 highest suicide rates. And to the state's credit, they said, we want to do something about this. 2/3 of men in our state are dying by suicide with a firearm. If we wait till a man is in crisis and has a loaded lethal means, we're far too late. So they partnered with our organization and our sister company, which is Cactus Communications, a marketing and branding agency, and a suicide prevention nonprofit. And when we started out, we realized that we really need to change the culture around mental health. So this is where we're getting into that change process and change dynamics. And we needed to find ways to decrease stigma, to increase help-seeking behavior with the ultimate goals of decreasing suicidal ideation. And one of the most challenging parts is making sure what we did wasn't just a flash in the pan. We all know you can put a bunch of resources into something, do a great workshop, pull people in, they get super excited, they do it for 3 days, but that doesn't create lasting change within an organization or a state. So that's what that is, quite frankly, the challenge we were up against. And ready for the next slide. I know there's a delay, so no worries. So in pulling our team together, we knew that we needed very much a multidisciplinary team. So we obviously needed mental health experts like myself, but admittedly, I'm not funny. I can't do marketing. So we needed to get creative marketers, people that are really good at conveying messages to the masses. The analogy I use all the time, and I throw my own profession under the bus, oftentimes we think we should be leading these campaigns. And the reality is, if Starbucks wants to introduce a new coffee to the market, they don't call me. They call marketing and creative experts. But when I can sit side by side and make sure mental health best practices are getting put in this funny, creative, sexy language, all of a sudden we have something that's going to get some ground. And then obviously suicidologists in the mix as well. So in our research, you can just load all of these, Sasha. I'll just go through them very quickly. We did a wealth of research. And when it comes to change management, really understanding what the viewpoints and perspectives of and what the barriers are for your target audience in making whatever change it is are essential. So these are the 8 that we really identified. I'm going to go through them super quickly. But first off, we knew we had to meet men where they are, where they work, love, and play. Men weren't going out of their way to go to a behavioral health center or take a mental health screening tool. We had to meet them. They didn't want to hear any psychobabble. They don't want to think about, some nerdy shrink laying down on a couch and, glasses. They wanted it to be real. We also have to give men a way to potentially fix it themselves. Men oftentimes want to give it a shot on their own rather than say, hey, I need help and just go to a clinician. We also know our healthcare system is really complex. Oftentimes, even when people want care, they don't know where to go. They don't know which provider accepts their insurance. They don't know how to use their insurance. We had to make that simple. We also wanted to show other stories of recovery. Hope and recovery is a little bit soft for this language, for this audience, but you know what we're going for, of testimonials so that men knew that they weren't alone. We had to target the most at-risk men. So that is the man who is the least likely to reach out for support and therefore the most likely to die by suicide. And then we also heard in our research that men were very open to also giving back. Oftentimes, men are much more likely to help someone else than to help themselves. So if we could lean into that, that would be a win. And then also, we know that men don't live in a vacuum. Other people around men want to support other people, whether that be partners, coworkers, children, parents, you name it. So we had to have a way to do that as well. So jumping on in, obviously I'm like synthesizing, 2 years of research into 3 slides. So bear with me on that. But what we learned was if we used humor and male stereotypes to make it light, to make it funny, to make it approachable, that was the one way we could crack the door to get men talking about mental health. And with the next slide, we'll show you a little bit of what that looks like. Okay. I'm just going to let this video speak for
7 in the fast lane. Breathing exercises are a subtle yet manly way to combat stress and anger. Watch as I demonstrate. Close your eyes and take a deep breath through your nose. Feel the breath travel down your gullet and into your belly. Now, slowly exhale. Again.
Thanks for making that work, Sasha. Good work making the audio come along, and I'm glad at least we're getting some laughs. Not your traditional.
You know that men have feelings too? No, not just the hippies.
That's another great video you can watch sometime for sure. That's another public service announcement. So what we've been able to do is work with states like Colorado Office of Suicide Prevention, and they actually sponsor and fund, if you watch a Nuggets game, Avalanche, we actually have a 15-second spot with the Broncos this fall where Dr. Rich is popping up. And as you can see, he's not your traditional doctor. He's part football coach, part drinking buddy, and part therapist. And we found is that that's what gets men to lean in. We're meeting them where they are. And Sasha, we can go through these next through a little bit quickly. So in addition to a website that gets men there, we had to meet them where they are. So we worked on a campaign where we have these great posters. As you can see, these turn people's heads. The one on the left, I get no exaggeration, I'd say 1 email a month about from someone saying like, I was taking a piss in a urinal. I was talking to my supervisor. We laughed at the poster. We started talking about mental health. Before we knew it, we started a group and, whatever it might be. And it's so cool to know that just this creative messaging is enough to be that first domino sometimes. But then, of course, we have a site on the back end, which gets there. We also have stickers. So we see these a lot used in construction sites and construction helmets and things like that. You can jump to the next one. And we also have a construction specific campaign, which has been really helpful and important. As we know, unfortunately, the construction industry does have a higher than average suicide rate. So this has been a great way to reach that population. And we're not showing the website, but feel free to go to mantherapy.org. It's open, it's free, accessible. We're not tracking anything. There's no catch, like we're not selling anything. And men can raise their awareness about mental health and connect to supports. But jumping through, that data and evolution of the tool is incredibly important. And there we are. So we call Dr. Rich the hardest working therapist in the world because he's seen over 1 million patients. We have a great time on site. So for your reference, or to put that into context, average time on site for anyone is about 8 to 30 seconds. For Gen Z, that's tragically about 1 to 2 seconds. So when we have men coming for about 3 minutes, we know that they're actually digesting content. We also have a validated mental health screening tool that's really funny on the site. And we found that men not only take it, but they share it with their friends because it's funny. And the win for us is that we're getting men to take a validated screening tool and actually see their results and engage in looking at what are my options to work on this issue, whether it's depression, anxiety, substance use, or anger management. And then we've had over 40,000 men click the red crisis phone. We have an ever-present crisis button and connect to Suicide Prevention Lifeline. And additionally, this approach has just caught a lot of attention. So I got an email in my inbox. I totally thought it was spam, but I decided to respond. It was from Facebook, and it was actually Facebook's safety team. And they said, we want to address men in occupations at risk for depression, substance use, and violent behavior, as well as suicide. And we used our assets, some of those posters and digital images that you saw. And it was actually one of the most successful campaigns Facebook has ever run, competing with big brands like Coke and all of that. And what that speaks to is creative messaging does work, which is awesome if you do it even around a stigmatized topic. And lastly, the thing that really gets us going, of course, is that we have countless voicemails, emails from people saying, my favorite one, or not favorite, but most meaningful one, is a man who calls and says, I want to help this site however I can. And he breaks down in tears saying, you saved my life last night. I had a loaded firearm. I was ready to pull the trigger. I ended up going on the site, not laughing, but like leaning into the humor. I clicked the crisis line, talked to a crisis counselor, and ultimately got to the hospital the next day. So that's why we do this. But in addition to that anecdotal research, diving into real capital R research is important when we're talking mental health. Of course, change management across the board, but more so when it comes to health-related things. So we were awarded a $1.28 million grant from the CDC, and we were trying to research to say, does man therapy in combination with other mental health screening tools provide additional benefits compared to A, nothing, or B, traditional screening tools? And the results of the study, again, summing up 5 years of research in this one in 3 slides, was that over time, both men in the man therapy group and the traditional mental health screening group did indeed experience improvements in suicidal ideation and depression, as well as stigma and illicit drug use, which is awesome. It's good to know that no matter what sort of mental health screening you're doing, you can have benefits. But to get to the question we were really interested in, not to be too narcissistic, is that when participants did get the man therapy exposure, they did have an initial greater improvement in social support, greater improvements in stigma, and men were 40% more likely to actually reach out for professional support, which is pretty unheard of. Think of a campaign, a poster, a website, getting someone to be 40% more likely to do anything, never mind reach out for mental health support. So that's the key. And I know that was very fast. I just want to hit pause and see if there's any questions on just the man therapy journey, and we'll be able to tie this back to the stages of change, if you will, or the community readiness model. But if there's any thoughts or questions before we do so and provide another mini case study, I wanted to pause and do so. Sasha, feel free to take over too.
Yeah, I hope there were notes being taken, because I think there was a couple key things that you pointed out, which makes me think of how we hire in construction and who we partner with to do implementation. So how well do we know our audience? Have we gotten to the place where you have eight different tiles of what matters to them, what's important to them, what's compelling for them, and what are the metrics impacting them? Do we know our audiences that well when we think about delivering technology solutions? Have we done that level of user research to understand? And when you look at that user group, have you really dialed into how they want to be communicated with and what matters to them and the form of that communication, meeting them where they're at? I thought that was incredibly powerful. And it also explains why we should have marketing partnered right next to product, and probably a neuroscientist or a psychologist, a certified psychologist, helping us as we plan that implementation phase. So I think those are the notes that I took away, but I definitely want to hear from the group if there are questions. Feel free to unmute yourself.
Yeah, I had a question.
A good portion of our workforce here in Texas in the heavy highway industry are Spanish speaking. Is the website available in Spanish?
It is not as of yet. So that is very much on our roadmap. One challenge we face is, there isn't a strong business model behind this, and that we set it up very much as a nonprofit. And we do license it to states and organizations, but we very much do so at cost. So we're constantly working on it. We actually just got some funding, and we're actually looking on expanding Dr. Rich to have other folks who look different and including Spanish. So it's on our roadmap for the next year.
Great, thank you.
Great question.
Question about the socioeconomic dynamics of the background work that you've done, and you may have touched on it, I just missed it, but obviously you talked about construction and the high rate within construction, but did you find across socioeconomic backgrounds that there was really a differentiation between the suicide rates, or those susceptible to suicide, and then those that called the crisis line too, that, and is there still that disconnect there? You could just speak to that.
It's a great question. And so suicide is a very complex issue, as you can imagine. And while the rates are high, considerably high, 40,000, the base rates are really low in terms of doing, statistical, nerdy psychologist research over here. So what we do know is that white males between the age of 25 and basically 55 account for the largest percentage of suicide deaths in the US. And then there are occupations that do have heightened risks. So construction is one of them, lawyers are another group. Think of high stress, sort of bottle it up, not having a lot of access to resources. But that being said, it's so nuanced of, let's say I'm in a specific industry, but the culture that places me at higher risk. But if that culture or my station, for example, first responders also have very high suicide rates, unfortunately. If I'm in a supported culture, that's a protective factor. If I have a great family, social support is another great resilience factor, protective factor from suicide. So it's very, very nuanced across the board. I hope that answers your question. I'm sorry it isn't easier to answer.
All right. Well, I appreciate the questions. Continue if you want to use the chat as well to get my attention. Feel free, because I'm keeping that open. But I want to move on, because Nathaan, I want to talk about scale and how we scale. Let me just quickly share my screen again.
Of course.
So when we think about, I think especially in construction, when we think about change management and instituting new ways of working, the goal is transformation. We're looking to create an implementation that creates a transformation of the culture, of the processes, of how the organizations operate. And one of the things that I think has been, we can have moonshots that do amazing things as one-offs, but that sustained, scalable success piece, I think, is a little bit challenging for us. So I'm curious if you could share with us how you've leveraged that success of Man Therapy. What other organizations or demographics has that pulled you into, and what does that look like?
So off the bat, originally we thought of this as a campaign, like a sustaining campaign, but here we are 10 years later. We just had our 10-year anniversary of Man Therapy, which we're really proud of because there is a market need, because we really leaned into understanding our audience, and we've been able to evolve the website, the tools, the outreach materials to stay relevant. So that's the biggest thing. And as I mentioned, we're not making money on it, but we are doing enough licensing it to states to make sure that we can keep innovating within the tool. And the success of that actually led us to a number of other verticals. What we've realized is that we were really onto something, in that mental health is a stigmatized topic for a number of groups, not just working-aged men. College students were another one. So with the success of Man Therapy, we were actually approached by Colorado State University, who's up the road from us, and they had 17 students die by suicide in 2 academic years. And CSU is not alone in that. Unfortunately, you can just load all those, Sasha. Suicide is the second leading cause of death on college campuses, with about 12 to 1,300 every year. So we again did our research and said, let's look at what's happening here. And Sasha, there's 2 more, if you could load those. Thank you. When we did that research, and again, having been a college counselor, we know that unfortunately the demands for counseling have by far exceeded capacity. So utilization rates have gone up over 5. Now we're up to like 5 to 7 times of enrollment. And we know that the budgets of counseling centers have not gone up 5 to 7 times, unfortunately, because mental health is kind of an afterthought in many respects. And additionally, just looking at the bottom right stat you see here, 83% of students are saying that their mental health negatively impacted their academic performance in the previous 4 weeks. And when we look at the data, the very best of counseling centers can meet the needs of about 15 to 20% of their student body. So for me, that begs the question of, what about that other 50 to 60% that isn't getting clinical care? And I don't have research stats on this, but I wouldn't be surprised if, especially through the pandemic, we see similar rates in the workforce of people's mental health getting in the way of their productivity, their ability to work, their ability to show up, and all of that. So that's really essential. And one more point before you can leave this slide. No worries, Sasha. The other thing that was so alarming to CSU is that of those 17 students who died by suicide, over half of them were not on the school's radar as having any challenges. They didn't go to the counseling center. RAs didn't see it. They weren't talking to a dean about their challenges. And that's unfortunately representative, across the country amongst college students and just about our whole population. 50% of people who die by suicide have never seen a behavioral health provider. That's the culture we're trying to change. So jumping to the next slide, thank you, Sasha. As we did with Man Therapy, talking to our end users was essential. We need to intimately understand, what are the barriers to you reaching out and getting the support you need? What would something actually look like to make this topic more approachable? And we came up with 5, or we didn't come up with 5, we heard 5 key insights when we synthesized all of this research that we did with students. The first thing we heard loud and clear, and I think this often does apply to many people in the workplace, students would say things like, I'm away from home for the first time. I'm lonely. It feels like everyone has their shit together. They know what they're going to major in. I have no idea what I'm going to do with my life. I'm lonely, so I'm coping with drugs and alcohol, and I'm so anxious I had to skip my last tests. Oh, by the way, I'm not sleeping either, but I don't have any mental health challenges. A lot of times people just aren't conceptualizing what they're experiencing as related to mental health. So we knew we had to be much bigger than mental health, because if we just made a mental health tool, we'd probably only get that 10% of the student body who identifies with mental health coming to the platform. And again, as with Man Therapy, our target audience was getting that larger group with a population health approach and changing the culture. The other thing students said was that, I don't want another crisis line. I want somewhere where I can build the tools in my toolbox to ideally be able to have the resilience to overcome some of these challenges on my own before they escalate to me needing to go to the counseling center or go to tutoring because I'm about to drop out. Then this one comes very obviously, working with Gen Z and millennials. If it doesn't look and feel cool, students aren't going to use it. It's that simple. So we had to put a ton of thought and time into making sure that our digital experience matches that of Snapchat, Facebook, Instagram, take your pick. Students just won't use it. Like they told us point blank. And then the last two were really important. And that students said, if I go to whatever you make, this digital tool, and I type in something like prescription drug abuse, sexual assault, or dropout, and I'm worried that I'm going to get a knock on my door or a call from the dean of students, there's no way I'm touching your thing. Or if I do use it, I'm not going to endorse what's really going on. So we had to protect that confidentiality. But on the other side, everything in students and Gen Zs and millennials worlds is personalized. Think Spotify, think sadly your news feeds, like everything is personalized. Interestingly, Gen Z and millennials are the most tattooed generation, and think about the ultimate personalization. I think that's an example of that. Not that that's a good or bad thing, it's just a phenomena. So we had to customize it for students. So the way we think about this when we get into the process, and this is a model I highly encourage you all to think about, it does take more time than just a top-down decision that we're doing and making and pushing down. But once you observe a need, so in our instance, it was a very high and alarming suicide rate. Observe that need, do the research, brainstorm a bunch of ideas, come up with a hypothesis, and then actually at that nexus point there, put it in front of students. So before we made this platform, we came up with about 20 ideas. We put all 20 in front of students and said, which ones do you like? Which ones do you hate? Right off the bat, we got rid of about 15. We're like, those won't work. But we took ideas from all of them, tested them, experimented, iterated, and then developed, because we had a much higher degree of confidence that what we were making was going to resonate with students. And then another super important part of this journey, and this is what really fuels sustainability, is you don't make the thing, put it in the world, and expect it to work the same today as it will in 2023. Just think about all the changes we've dealt with in the last 2 years. The world changes. And if we're not updating our interventions, our messaging, and staying relevant, whatever we're doing is quite frankly just going to become irrelevant and fall off the crack. So these blue loops essentially start the process again with an observed need. So what we came up with, and you can jump to the next slide, is a well-being model taking those insights that really gets upstream of student health. So what we came up with was a 3-tiered approach to well-being for college students, which we found is very scalable. So we have 3 main areas of the site. Succeed is all about academics and career success. Thrive is about physical and mental health, and Matter is about purpose and connection. And something that's super important, and we see in our data, is that most commonly students enter the site and start looking for support around academics or finances, because who isn't stressed about one of those things? It's very approachable, it's not stigmatized, so they get into the site. Once they're there, we find that by far, hands down, the most viewed content in the site is all mental health related, specifically stress, anxiety, depression, how to help a friend I'm worried about, and sleep coming in at number 5. Of course, through COVID, we had COVID topics pop up, but historically that's been most used. And the insight there, again, is if we branded this a mental health portal, we wouldn't get students into it. We had to use this side door. And with our ultimate goal of suicide prevention, we also know that the straw that breaks the camel's back could be finances, it could be academics, it could be loneliness. So all of these things are laddering up to our goal of suicide prevention and supporting mental health and well-being. And then talking about scaling, we realized that, people are people, and most people have succeed, thrive, and matter in their life. And we've actually been able to transcreate this for other audiences. So most notably, we're running a pilot statewide in Colorado with, and these are open, free, and accessible. Anyone can go to these sites and check them out and explore, for veterans throughout the whole state. And we actually populated local resources in all 64 counties throughout the state of Colorado, because one of our insights in veteran work is that there are a wealth of veteran resources available. There's 583 registered veteran serving organizations in the state of Colorado alone. And when you connect with a lot of veterans, they say, yeah, I've never connected with another veteran or a veteran serving organization. So we knew we had to help facilitate those connections. And very similar with first responders. So jumping back just to in our impact, this is going back to college students. You have to make sure that what you're doing is working. I don't care if it's related to health and well-being, if it's getting people to do things digitally instead of on paper, whatever it is, if you don't have a feedback loop, you're never going to be able to make sure you're getting the outcomes that you want. So we have a number of ways we get at research in terms of short, midterm, and long terms. This is some of our midterm goals where we did a survey amongst our whole student body. We had over 1,200 respond. And you can see that students on the left are indeed learning skills as a result of using the tool, whether that be stress management skills, academic goal setting, or getting strategies for better sleep. And then when students are learning skills, we have 70% learning those skills, the vast majority, almost 90%, are indeed practicing those skills. So, we're practicing what we preach. We're helping individuals turn that information into action. That's a huge thing that bothers me in our world is information is not action. Most people who smoke know that smoking's not good for them, but they continue to smoke. So we have to get to those other layers and understand those barriers. And then lastly, in terms of campus health and well-being, connection to resources is a very important metric for our administrators on campus. And having 2/3 saying, I'm learning and connecting to campus resources is a huge outcome for us.
Between the two. So one of the things that we talked about earlier was really understanding your audience, and you've created that formula, if you will, for success of looking at understanding your audience, knowing what they need so well, putting something in front of them for them to react to clearly make sure you did hear what they need versus what you are imposing upon them that they need. Is there a correlation between that upfront legwork of really getting to know your audience well in connection with that ability to scale this over multiple groups, or to different groups? What is that correlation between the two as you see it?
Yeah, it's a really great question. So I would say that is very sort of target specific. So, we're talking about health and well-being. Health and well-being is a universal experience to all humans. So I do think because we intimately understood this target population, and what's nice about college students is they're very diverse. We made sure to interview non-traditional students, international students, student veterans, across the board. And when we did that, that made it very replicable. Yeah, if we did that research with only 18-year-olds and first years coming into a specific school, I don't think it would have been as generalizable. So the other thing that we do is we very consciously tend to oversample students or individuals from those marginalized identities or groups. Like, let's not just go to the majority people. If we're doing this in an organization, let's not only go to managers. Let's go to managers, middle management, as well as the entry-level worker who just came here and is deer in the headlights week one on the job. And I think that's what leads to that replicability or scalability. It's a really hard, I don't even know.
Good try.
but that's what we have to get at is don't be satisfied with an N of 10 in a very convenient sample. This work does take time, but the reason it works and the reason it creates confidence is when you do decide to put resources into making whatever it is, whatever sort of change, you are very confident that it's going to work. And I've seen so many organizations try a top-down approach. They try one thing, they implement it. It takes 3 months to implement. Everybody hates it. It flops, and then they're right back to the drawing board. I would rather take 6 months, really get to understand my audience, understand the barriers, understand and help them understand the benefits of doing whatever it is we're talking about, and then having confidence in deploying.
And one of the things that I think that brings up is having the right people within your organization, within the right roles to do that work. So for instance, if you're thinking about the first 2/3 of this work is actually going to be getting to know your audience, you're going to want to make sure you have somebody in that role who is adept at surveying, understanding, listening, open to pushback, open to challenging ideas, no sacred cows. essentially you want to make sure you have that right individual in that role. And then thinking of each other phase of that project, having somebody else who's right for the next phase of the project. When you think about the data that you leverage to measure the impact, is what we intended to happening? And if so, at what rate or what impact? How do you think about technology enabling the data capture piece to really put a fine point on, we know what we need to measure? Does the data inform what you're going to measure? Does the technology allow you the ability to measure? What's that relationship between metrics of success and where technology enables that?
Both and. So one really nice thing about technology is, depending how you make it, who makes it, all that jazz, you can track a lot of things. Are people using it? How long are they using it? Where are they dropping off? Where are potential pain points? And from a product design perspective, if you're not looking at that data, I think that is just a huge mess. It's like right there, it's collectible. It's also in most cases anonymous. So you don't have to feel like you're like peering in on your employees and like, who didn't do this thing? There are programs and ways to do that, but we're not fans of it. So that's one, but I do think getting at the essence of things outside of just technology is essential. So that's where our survey work comes in. Do students or first responders or veterans like the tool that we made? Is this improving their work? Is it making their life easier? And again, I'm thinking of if you're implementing a new process for, submitting reports or requests, whatever it might be, you have to close that loop and get those intangibles. And that requires, the way we do it is a combination of looking at analytics, survey data, and then some key informant interviews. And I think without doing those three things, you're not getting that holistic perspective, and you're not going to be able to iterate and continue pushing the needle forward. It also shows people that you care. And when people know that you care and they're putting their thumbprint on interventions, especially when there's change, they're so much more likely to buy into it, rather than, the boss said I have to do this and I hate it, and then they half-ass it.
Nobody on this call has ever experienced that.
I wouldn't imagine so.
I think this is a therapy session a little bit, I feel seen. So when we think about this next phase, so really looking at organizational readiness, and I had shared that organizational model early in the call, could you walk us through a little bit about how you apply this then to the work?
So where this comes from is actually a psychological model where, I'm just going to use a quick example. Let's say I was a raging alcoholic. I could be in different stages of my journey. I could have no idea that that's a problem. I could say, maybe this is a challenge and I should do something about it. Or I could be doing something about it. I'm going to simplify it to a couple of stages. And let's say you were trying to help me. If I had no idea, you would approach me very differently than if I came to you, Sasha, saying, I want some help with my alcohol consumption. And the same principles apply to communities. And what I see so often is a lot of times C-suite folks in an organization are trying to lead some change. I'm just going to use mental health because that's what they were talking about. And they're trying to do some of this like initiation and get people going. But the challenge is the average employee has no idea that that is a challenge. Or same thing, if it's budgetary, if it's a process of switching a process from paper to digital, a lot of times folks don't know that that's a challenge. So where and how this can be most effective is, one, if you don't know where your general company body is in respects to a specific issue, in my opinion, you can't start to initiate change adequately, because you might be, trying to make change when people don't know that there is a challenge at all. And then secondly, I think this model is super important for leadership, because all too often I see folks saying, okay, we're on level 1. We know there's no awareness, but in 3 months, I want to be at community ownership. And that is simply not realistic. It's very important to understand that change takes time. We are creatures of habit, and culture is very hard to change. So with that, this can provide a really nice model to set expectations for both leadership who's trying to initiate this, as well as folks who are ideally coming on board to be able to get to where you want to go. So a question we have for the group, Sasha, if it's okay if I just jump in with that, is identifying a challenge in your organization where you're looking to engage in some change management, whether that is raising awareness of mental health or some sort of process improvement, and asking yourself where you think you are on this continuum, and then seeing if there's a discrepancy between where you think your average employee or the summation of your company is.
This is really exciting to see this. I'm trying to grow our family business right now. I got 40 employees with us, and I know that we need community ownership to make sure that we can get, action and get to where we need to go and improve our status and our overall well-being as a company. So I'm an 8. I think a lot of my staff is at 1, some still at 2, others are at 3. Maybe some of my management team is at 4, and then I think I'm personally driving it at 7 and 8 is where I think that and I think I need to go back and make sure that I'm bringing people along in a way, meeting them where they are, and do a better job of that.
Yeah, and first off, thank you for sharing that. And secondly, I do think a lot of times incidental friction can occur when, Jackson, you're at 8 and you're talking to an employee at 1. And when there isn't a vocabulary to talk about that, it can be like, whoa, Jackson doesn't get me. And
Right.
I hope Jackson's your first, not last name.
Yeah, it is.
Okay, perfect. So even just presenting this and like not doing, a whole day workshop or anything like this, just saying like, hey, this is a way that we can talk about any change we have in the organization. Where are you? Where am I? Cool. Well, let's talk about those differences. You don't have awareness of what I'm trying to do. What don't you understand about what I'm trying to do? And then having them ask those same questions of you. Why are you so far along in this, Jackson? How are you so confident in the way and the course that you're charting? Because you know what? My vantage point is completely different. And it can form a much more collaborative approach.
Yeah. No, this tool is I'm gonna find this, blow it up, and put it on, because this is create that common language where we can all identify where we are mentally, and looking at, because we do have multiple initiatives that we're working through right now at different stages of the business. So some we might be at 6 and 7 collectively, but then others are going on, and this is really great.
Awesome. And just for your reference, Jackson, if you do Google search community readiness model, you'll find like toolkits, you'll find like a protocol of how to introduce it as well. What I like about it is some people can go that far, and some people can just post this on the wall, and that's enough of a vocabulary to make it work, which is great.
Yeah, we've been going through the Cotter change model, so it's a little bit different version of this, but it's I like the way that this looks at, because you can point at it and identify exactly where you are in a more concise way, I think.
Mm-hmm. Well, you don't need a ton of training. Like most people can get it in 2 minutes, which is really helpful in my opinion.
Nathaan, I wanted to ask you a question and was wondering if you could kind of speak to, so some of the challenges I think a lot of organizations have is that I've most recently heard 6 to sometimes 7 generations under one roof. So with this case study, what I love is that you're able to clearly define a demographic and target them in that messaging and put all the creative energy behind how to message to them. And I think that's the biggest takeaway here. But when you think of this in terms of organizations, and I'm thinking of, where there are multiple generations, how does this readiness model or this language really help to reduce some of the complexity that comes with having those multiple organizations or generations under one roof?
Mm-hmm. Yeah, absolutely. So I'm just going to start here. Humans are incredibly complex. Subgroups are incredibly complex when you're trying to get people to track to the same goal. And I think one way to think about it is, again, providing that common language. And I think, if you have a huge majority of millennials, let's say, that are totally not bought into whatever idea or change you're trying to push, that can be the call to action to say, we need to go out of our way to understand what is making this group in different alignment than us. I was trying to say not misaligned. No one's misaligned. Have a different perspective than us. So again, going back to the research that we did with mental health, you can do this with any group. If you don't understand their pain points, you're not going to be able to initiate a successful intervention. So one other super simple activity, I can explain it in a minute, so I'm just going to do it. It's called the 3 Bs. You identify a behavior that you want someone to engage in. So let's just say, Jackson, what would the behavior be for you all, if you don't mind?
Right now we're trying to get everybody showing up in the and working within the same. We've had a flexible culture where you can show up at 7:30 and work till 7. So we're trying to get everybody contained into a container so I guess set work hours in our production shop.
Super helpful. So
yeah.
That's the behavior you want. So the next B that you do is identify and have people identify all the barriers preventing them from do so. School drop off. I like to sleep in. I like to leap out. Let people articulate those to you. And then the third B is the benefits. So very clearly convey to those people, hey, if we all do this, we're going to be more productive. We're all going to make more money. We're going to like each other more, and we're going to be able to get our work done earlier, whatever it might be. Right. And when you can lay that out, again, it's a nice framework for people to feel heard on their barriers. And then maybe there's some barriers that you can work with. Someone doesn't have a ride, they can't get there, it's too early. Like, okay, you know what? Instead of starting at 7, let's all agree to start at 9. I'm making that up entirely. But then something that, in my opinion, in change management, we often overlook is those benefits, clearly conveying what are the benefits of us making this change. More often than not, we say, hey, we're doing this, deal with it, have fun. Whereas when people understand, oh, this is for the greater good of the company, it's going to benefit from me, et cetera, oftentimes that can be another nice dialogue that gets that buy-in.
Yep. And one of the things that, as in the family business, we've been struggling from a perception is we'll talk about the benefits. I don't think we're doing a good enough job listening to the barriers and identifying the barriers. When we talk about the benefits, one of ours is we know we can provide health insurance if we can increase, our productivity and, get some of our rid of some of our profitability loss. So that's why we identify this structure. We want to be able to offer health insurance by the end of the year. But I think we're working against it. And we talked about this in our leadership meeting last week. We're working against a stigma that, we know that we're going to take this money and make it to the good of the company. But so many people have a skewed perception of what upper management does that, they think that it's just fattening the owner's pockets. Right. If we increase productivity, they have that what's in it for me mentality times 10. And so trying to, get over that it's more so a societal perception than it is just a company perception. So we're struggling, I think, with that right now, that there's so many people that have been taken advantage of so long in the way that, they're exploited, or labor's been exploited, that you can have good intent. You can, I know we've identified the behaviors, barriers, and have true benefits, but we're getting a lot of resistance. And so that's been one thing that be interested to hear people's perspective on how to get around that.
One thing I think is challenging, Jackson, you said you're about 40 people.
Yeah.
So I will say that, in my opinion, from a change management perspective, that's one of the hardest sizes in some ways, because in some ways, you want a lot of transparency, but it's not like everyone's talking to the leadership team day to day. You're probably, at job sites and all that. So I think it's a question for you all of how comfortable do you feel being potentially a little bit more transparent in some of what you do? How can you show them, like, hey, here's our bottom line, here's where these dollars are going to go?
This is a great, so that was exactly my thought process. So we started showing our company financials quarterly. We showed it. Well, we weren't being profitable because we're growing, we're adding upper management, adding structure. And so we actually had a blow up recently where employees were like, we're still not profitable. We're having a little bit of a burn. And everybody's like, well, what are all these people doing here that we're hiring managers? Why are we not being profitable? So I actually decided to pull back some of the transparency, because I feel like it was being over transparent, that people were being over paranoid about their productivity, that they want to do well, they want to come up and show up for the company. But now, because I showed it to everybody, showed them how much we're making, how much we're not. And I find that there's different levels of financial literacy and understanding, that I think I made an error and put too much burden on my staff. And so that's interesting you said that, because I found that, that was my thought process. And I think that is what we need to do. But how we did it, I think actually how we rolled it out ended up failing us in the near term when I was trying to, fix something long term.
Well, first off, thank you for sharing that. Oh, did somebody chime in?
Nathaan, hi, this is Peter Lisinski. Just about the question, kind of like this, and I mean, I think that there's two parts, right? There's the human behavior part that you're looking at and so forth, but one of the other parts is how management sets expectations and how they deal with people overall, because some people, say something, they mean it, people just follow it, and other people, they it's like raising children, that if you give them an inch, they take a mile, and the next thing you know, it's really hard to take something away from them. It's like taking candy away from a baby when someone was happy. And so that's part of it. And I think it's kind of a one-way street too. You cannot, with employees, you can have a great employee, and without managing expectations and such and holding them accountable to get what you want, you may just have to get different people sometimes. I mean, and start over, because when they start, you can tell them anything and it's fine. Everything's fine, and then, when they've been there a while, it's much harder because, so I think that, I guess what I'm saying is how does the employer behave, right? In order to create the culture, the environment, and you can show, numbers and such, but really it's an emotional decision for them. And
Absolutely.
True.
So it's, and then there's the fairness thing, right? Why doesn't he have to do whatever and all that stuff? I mean, it's unfortunately, you're somewhat of your own doing, I guess is what I'm saying. So it makes it harder, and I don't know, I think it's challenging to change that. And I think that's what you're experiencing.
I'm living through it, right? It is extremely challenging. It's interesting you say that the 40 size company is one of the harder sizes too, because it is, I've seen organizational change management at a much higher scale. I was like, oh, it wasn't near as an employee. I saw the things that successfully helped me to manifest change with an organization. And now that I'm the CEO coming in and trying to do it, I'm just like, oh my God, this is like, I'm doing all the things I wish that my boss would.
Totally.
But the perception's still complete. I'm not the troop by their side now. I'm the general, and
Right.
Getting that messaging it's been really interesting. I would love to write about it someday, because it's
The one other thing I'd add really quickly, Jackson, tying back to Sasha's point of understanding your audience, is the impact you had in sharing your financials had very different impacts with subgroups within your organization. And I would argue that if you could take the time and understand those subgroups a bit better, you would likely be able to share those financials in a more effective way.
Absolutely.
Maybe it is okay to share different financials with group A than group B, or you find a set of financials that you can send to everyone. And maybe it's a little watered down, but it's not going to be alarming to the group with less financial literacy, and it's still going to be enough for the group with high financial literacy.
Yep.
I think when we don't know our audience, that's where we do broad brushstrokes. And my saying is one size fits none. And, that might have been what you experienced there.
Well, yeah, back to the community readiness model. I was at 2. I wanted 1. I went and tried to implement what I thought was the solution to get us to 1. And
Right.
I didn't look at my staff and compartmentalize. Okay, they don't need to be fed this information. I still want to be transparent, but don't want to alarm them. And that's the lesson that I learned the hard way in losing staff. That was just, I think, ultimately got so frustrated that they felt like nothing they were doing was making a profitability impact, when it really wasn't. It wasn't that serious. I think that they really, I lost a really good employee recently, because I really felt that he felt like nothing he could do was making the company better. And that was the lesson I learned the hard way. It was like, okay, well, roll that out too soon. So when you showed me that 9-step model, I was like, oh man, that's what I've got to live or die by that tool with my staff. So, or with my company.
And this is really why we wanted to do a case study with Nathaan, is because what he and his team have been able to do with Man Therapy uncover so many key components to what we're trying to do in construction. Essentially, you have all these startup tech companies filling a void of the necessity of technology to enable these workflows. But at the heart of it, the people who are doing this work are more than capable. They're experts. They have 30 years sometimes of muscle memory about how to do this work. And yes, it's not the most efficient. And yes, it's physically challenging. And yes, it's high stress. And yes, it does have a mental health impact, specifically for this audience that that Nathaan is targeting. So that means in order to get them to change and to see the change that you're introducing as valuable to offset some of those other, occupational hazards, you really need to know your audience well. And it begs the question of, how important is that messaging? And who's capable, who's your subject matter expert at delivering it? So if your role as a leader within your organization is CEO and you're leading the organization, please tell me you're not also in charge of communications. Please tell me you're also not the one who's trying to decide how and when messaging should be shared and to whom and in what form, because that is not your expertise. And in general, I will say this carefully, majority of CEOs actually scale on a narcissistic side. So they're really good at getting things done, but not so good always at the empathy side. Also, it allows you to stay focused on what you're doing well and to outsource for what you don't do well or what you shouldn't be doing in addition to the job you're doing. So thinking about the team that Nathaan assembled, his role as psychologist and having a domain expertise there, but saying, I am not the subject matter expert when it comes to comedy and humor. And obviously he found some of the best people to do that because the campaign is really effective to the demographic that they're working with. So I know we have probably just a few moments left before our session here ends, but I wanted to just kind of thank Nathaan for joining us here today. I think there's a pretty big takeaway of who is doing what work in order to enable you as a leader to have a more successful campaign community engagement around that. And if you don't have those subject matter experts on your staff, how are you going to source and find them and network to find them? Because that's a really important question we need to be asking ourselves, especially as we're looking at scaling teams and organizations to address major challenges that the market itself doesn't always necessarily say, I see a need to fix this. So as we leave, I wanted Nathaan to give you just a moment to kind of say, if, kind of in summary, what would be your biggest takeaway for leaders today?
Great
Thank
question.
you.
Somebody has some background. Know your audience, do the extra work to go out of your way to know who you're talking to and be very clear in what you're trying to accomplish. Without those two things, I think that's where we inevitably have some misses. And it does take more time. I'm not going to lie, but that time will pay itself off in dividends.